Coming to the tumors of the nasopharynx, I am going to discuss about nasopharyngeal angiofibroma and nasopharyngeal cancer. Etiology. It is predominant in the adolescent males and in the second decade, and it is said to be hormonal dependent, that is testosterone dependent. Site of origin is superior margin of the sphenopalatine foramen. And the name itself, angiofibroma, indicates it involves both vascular tissue and the fibrous tissue. Extends into cranial cavity, nose, orbit, paranasal sinuses, and eustachian tube. Coming to the orbit, the clinical features are proptosis. As a result of the proptosis, the face appears like a frog face deformity. Frog face deformity is also seen in the nasal polyps. Coming to nasal cavity, clinical features are epistaxis, obstruction. As a result of obstruction, there is nasal voice. This is called rhinolalia clausa, and nasal discharge. If eustachian tube is blocked, conductive hearing loss is absorbed, and the nasal bridge broadens and cheeks swell. Next, coming to investigations, CT scan is done with contrast and to know the extension of the tumor. Then comes, here there is a sign, that is Hallman-Miller sign. The maxillary sinus anterior bowing is called Hallman-Miller sign or antral sign because maxillary antrum is involved, that is anterior bowing of maxillary sinus. And then MRI to know the soft tissue extensions, that is to intracranial or orbit. Then carotid angiography is done. Carotid angiography to know the extent and vascularity and the feeding vessels, so that embolization of the vessels can be done to control the bleeding during operation. Then comes treatment. Treatment is by surgical. Surgical approach is through endoscopic, transpalatal or intracranial, extracranial or infratemporal fossa approach based on the extension. Then radiotherapy and chemotherapy. Chemotherapy with DVD. DVD for doxorubicin, vincristine, dacarbazine. Then hormonal therapy with diethylstilbestrol and flutamide. Coming to the cancer, nasopharyngeal cancer. Etiology is wedge. V for virus, mostly Epstein-Barr virus. E for environmental, and G for genetic. And site of origin is fossa Rosenmüller, whereas in angiofibroma it is sphenopalatine foramen. And the extensions are into pharynx, nose, orbit, eustachian tube, and cranium, that is through foramen ovale and lacerum. Whereas in pharynx it is to parapharyngeal space and retropharyngeal nodes, and also to cervical nodes. The symptoms are in nose and the orbit. In the nose it is nasal obstruction, epistaxis, and coming to orbit, proptosis. Coming to eustachian tube, it causes serous otitis media and conductive hearing loss. Coming to foramen ovale and lacerum, ophthalmic symptoms and facial pain. And there is ophthalmoplegia due to the paralysis of cranial nerve 3, 4, 5 and 6. Whereas cranial 3 and 4 causes ophthalmoplegia and 6th nerve causes squint and diplopia. Coming to the parapharyngeal space, it causes cranial nerve palsies of 9, 10, 11 and 12. This is called jugular foramen syndrome when it involves 9, 10, 11, as this 9, 10 and 11 passes through the jugular foramen. And pterygoid muscles are also affected, as a result trismus occurs. Then due to involvement of retropharyngeal nodes, neck pain and stiffness. Cervical nodes, mostly the upper jugular nodes and posterior triangular nodes enlarges, and distant metastasis to lung, liver and bone. Coming to the diagnosis, the investigations are by radiography, CT, MRI and X-ray, and the popular these days is positron emission tomography. Positron emission tomography and endoscopic by rigid or flexible nasopharyngoscope, and biopsy can be taken by this. And the growth may be proliferative, infiltrative or ulcerative type. Then comes to radiotherapy. Radiotherapy by intensity modulated radiotherapy, IMRT, intensity modulated radiotherapy, and chemotherapy by cisplatin and 5-fluorouracil. This is for treatment of distant metastasis and to improve local control. For treatment of distant metastasis and improve local control. And treatment is by, and then comes for residual and recurrent disease in nasopharynx, radiation and brachytherapy. Brachytherapy is by gold grains. They are delivered at high doses to the tumor so that there will be less radiation to the surrounding tissues. And nasopharyngectomy by endoscopy or lateral rhinotomy and medial maxillectomy. If there are positive nodes, radical neck dissection is done and remove cranial nerve 11, internal jugular vein and sternocleidomastoid muscle.